I am a diabetes and endocrinology specialist. An endocrinologist is a specialist who looks at hormone deficiencies and hormone excess in the body. I also take care of patients who have type 1 and type 2 diabetes. And I've done extra training on top of my internal medicine training after medical school to specialize in this, an additional 2 years. So the reason I went into diabetes and endocrinology was because, when I went to medical school, I had the thought that I was going to be a cancer doctor. And then I tried that out in some of the rotations I did as both a medical student and as a resident, and it just wasn't for me. And I could tell day in, day out, with the type of work that you do, especially with all the work you put into it, that you want to do something that you're passionate about. And as much as there was a need for those kinds of doctors, for me, it just wasn't something I could do day in, day out. So I explored my other options. I had taken an endocrinology class in college, and I liked it, but I was like, well, I don't know clinically what does that mean. So I did a rotation in my second year of residency, and I loved it. It made sense to me. I enjoyed the work. I enjoyed the patients, the type of disease processes that I was looking at. And so that's how it started. I think as an endocrinologist, being somebody's physician, it's a privilege, to have somebody come and share a portion of their lives with me, even if it's only once every couple of months. I take that as a big deal. So for me, it's not just about, okay, well, these are your medications and this is what you need to do, but how are you doing outside of that? You have to treat the whole person and not just what they're here for that day. And I think that not everybody does that. And I think I do it well. So I enjoy that, and I think my patients feel comfortable with me, and I make an effort to try to make them feel as comfortable with me as much as possible. I definitely want them to feel like I care about them not only as a patient but as a person as well. My staff as well, they get to know the patients. They're always ready to help them. It's kind of a community feel when they're here in the clinic, that everybody's here to help, and that if you needed help, you could come to any one of us.